morning.
Diabetes, depending on the type, you have several different types of diabetes. The first type is type 1, which is absolute insulin deficiency. You don't make enough insulin. For some reason you've had an autoimmune disease, something like that, destroy your pancreas, so you don't make enough insulin. You don't make any within 6 months. And the second type is type 2, and it starts with insulin resistance and is followed by insulin deficiency later in the course of the disease. There's also gestational diabetes, which is diabetes during pregnancy, and then there's also diabetes insipidus, which is a totally different type of disease where you have large volumes of urine. So there's different types, and basically what diabetes is you're either unable to produce the insulin or you're unable to use the insulin you do produce. And you have high blood sugars, which are way beyond normal, and it destroys every organ of your body, or it can have the potential to affect every organ of your body. You know, some people suffer from kidney and eye disease, other people have macro circulation problems like stroke and heart attack. So this is a disease that causes high blood sugars due to insulin resistance or insulin deficiency. Some of the major ways that you can prevent diabetes are to keep more muscle mass than fat tissue. If you have a lot of fat, body fat, high BMI, you have a lot higher chance of getting diabetes if you have the genetics. Diabetes is somewhat genetic, especially type 2. Type 1, not quite so much. If your parents, grandparents, Uncle Fred, whoever has diabetes, you have a lot higher risk of getting diabetes if you have more body fat as you age, if you have a sedentary lifestyle, you don't work out at all, especially a desk job, and then also if you have a lot of stress and lack of sleep. Those type of things can lead to diabetes or bring you to the brink of where you do develop it if you have the genetic potential. Some of the groups that are prone to diabetes are non-white Hispanic, Black, Asian, Pacific Islander. Basically anything other than Caucasian have a lot higher, American Indian have a lot higher incidence of diabetes. Caucasians have the least amount of diabetes compared to the non-white population. So it depends on your ethnic background and it depends on your genetics. Those two things are the biggest risk factors, are genetics and ethnic background. And then of course body weight and sedentary lifestyle. Those types of things increase your chances of diabetes. In the 21st century, diabetes is incredibly revolutionized. It's amazing. I've been teaching since 1994, 1995. Things have changed remarkably. We don't even rarely use the same type of insulins. We don't use the same type of oral medications. It's amazing, and they've invented a lot of new drugs, such as Januvia and Byetta, that weren't even around 2 years ago. So insulins have changed. We have some that don't peak. Lantus is one of the best that works 24 hours. It doesn't peak, so a lot less lows happen, and also you don't have to eat around the insulin, so a lot less weight gain. So it's safer, more convenient, and works 24 hours, and that's been around for probably 6 years now. And then they have Byetta, which actually is a new drug. It's an injection that preserves the beta cell function, and it also increases first insulin response in people that have lost that quick insulin response when they eat. And then it also it kind of controls your appetite. It makes you feel a little bit nauseated sometimes, and it makes it so that you don't really eat the volumes you ate, because it slows digestion down. You don't pass your food along as quickly. So it has some really positive things. The negative thing is it's an injection, so people that don't like shots, it's harder to use. Januvia is a new drug out, and it breaks down the enzyme, or stops the action of the enzyme. It destroys the first phase insulin response, is the easiest way to say it. So it's a great new drug out, and it can be taken in a pill. And then there's also metformin, which has now been out for since the early 90s probably. And it's a great drug. It's probably the first one that you go on at all for diabetes, and it stops the liver glycogen from coming out during the night and having high liver glycogen, which adds to your glucose load. So mainly the medications have changed. They're much, much better. and they actually work on the cause of diabetes. Insulin sensitizers sensitize your own cells to their insulin, because in the past we just gave you more insulin, or we gave you pills that cause more insulin. Now we actually work on the cause of diabetes. We can turn around the resistance problem, and we can give you insulins that work like your own body. And there's new medications, like I say, Bayed and Januvia, that work like we've never even used any medications before. So it's amazing how medications have advanced. We've also looked over the last century and seen how diabetes, sugar, the levels have changed. We used to say you could be under 180. Now we want you under 140 at all times, and under 100 when you're fasting. So the tighter control, the better sugar levels, make it so that you don't experience the complications at nearly the rate you used to. It decreases eye disease by 76% when you're in range. It decreases kidney disease by 60%. Decreases neuropathy, which is tingling and pain in your extremities, by 56%. Decreases heart attack by 35% just by keeping your blood sugars in line, and these medications help you keep them in line. Diabetes is a disease that's controlled by eating right and exercising, and then using medications as needed. But most people, like all people, unless you're 85 years old when you get it, do use medications at one time or another in their life to control diabetes.